I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
The IDD Health Matters podcast is a joint production between Friends for Life and Intellect Ability. For more information, go down into the show notes and click the link where it says Learn More here.
Welcome to IDD Health Matters. I have two great guests today, Patty Haberkorn and Deanna Cox. They're both nurses. We're coming to you today from the Illinois Developmental Disabilities Nurses Conference, where both of you live and work, right?
Yes.
All right. Who wants to go first? Tell us about what you do in the field. How about you, Patty?
Okay. I have been in the field for almost 35 years. As of January, I'll be a DD nurse for 35 years. I've been at Futures Unlimited in Pontiac all my career. Kind of fell into the field. I was called by the then executive director as I was working on my bachelor's degree. He called. He was a friend of our family, said they needed a nurse and would I be interested at, Monday through Friday. And, well.
That sounds pretty good.
Yes. Since I was going to school, had two small children, a husband, the working mom, that sounded kind of attractive. So we thought, well, I can try it. And if I don't like it, I'll just go back to the hospital.
Sure.
And 35 years later, here I am. So, and then 6 years ago, I took over as executive director for our organization.
So you're
and
out
so we
of
were
the
fortunate
nursing part.
Well, I'm still the backup nurse.
Okay.
One of the backup nurse, the backup nurse. We've been fortunate to have Deanna for almost, has it been 7 years now? 6 years? Yeah, almost 7 years. So, she's been a real asset to the organization and the field.
So going back to one of the things you said, you kind of fell into the field. I talk about that all the time. I did the same thing. And so many people do. And you fall into the field because a lot of people don't know that this is actually a career opportunity, which is one of the reasons we're doing this podcast, is to help people understand this field a little bit more and see it as a viable career opportunity for both nursing and direct support professionals and really anything else. And you're a perfect example of the anything else because you started in nursing and now you're an executive director of a program. So Deanna, how'd you get into the field?
Well, right after nursing school, I started with long-term care. And in that long-term care, I took care of a lot of adults with developmental disabilities. And one I found out when I started Futures had come from Futures to us. So that's how I started. I didn't really start in DD, but after a few years, I just wasn't happy. And I saw an ad for Futures and didn't really know everything that they did. So I checked it out and talked to Patty, and I've been there for almost 7 years now, taking care of them, and it's kind of the same. It was just fallen into. It wasn't something that I sought out, but it's something that I love. So
it becomes a passion, definitely.
Yeah.
Definitely.
So here's a question for both of you. Did you feel that your training prepared you for working in this field? Nursing training in particular?
Not since I am the 40-year graduate here, I'll start with that. I went to Mennonite Hospital School of Nursing. That is now associated with Illinois State University. So when I went, it was still a diploma school. We got a very good nursing foundation, but there was not as much emphasis on people with disabilities as I now realize there could be, or that nursing students could benefit from. I did actually, take care of several patients that, were DD. And, I had no idea that it was going to prepare me for my future, but it did. But again, that was not my focus to start with either, and it wasn't even presented as a career option.
Yeah.
So I do think we could benefit from more instruction in school.
Oh, definitely. I don't feel like we were really educated much at all on the population, on how to speak to them, how to treat them like they're adults. Most of the time it was, if you did see them, it was during clinicals and you would see a doctor speaking to them and it didn't really go the way that it should have.
I can vouch for that from the doctor
Yeah.
side. I'm sure it didn't go very well. And I know my first experiences didn't go well either, because it's not because we don't care, But if we don't understand something or we weren't taught something, how can we know really how to do the best in that area? And that was one of the things that I had a lot to learn, that I learned the hard way. Learned it from, fortunately, I had a great group of nurses who had been working in the field when I started in the field, that I learned a lot from them, from the people that were in support, from direct support professionals and everyone. But I think we really do need to do a little better on the schools providing education in this field. And I'll tell you, probably like you, we learn about genetic conditions and things like that, but that's not really about how to provide health care for people who maybe don't communicate in the same ways that we do in using words. And that's what I'm really talking about when I'm talking about training. I bet you have some stories that you can share related to interesting cases or diagnoses that you came across along the way. I'd love to hear a couple of them.
Oh, well.
Where do you even start?
Yes.
You were talking about the doctor's point of view. When I first started in our area, many of the physicians were very established in practice, and it took a lot of training, for lack of a better word, or working with those docs to get them to understand that the people we served were adults, and that they mattered, and that their treatment mattered. There were some experiences where it was kind of like, well, they have a disability, and they didn't use those terms.
Right.
But that was, and yes, they do have a disability. And what do we treat them? How do we treat them?
They're a person with a disability.
Exactly. The treatment should be not any different than a person that supposedly doesn't have a disability.
Right.
So there was a lot of training. We've worked really hard in our area to establish good relationships, and I think we've got them with all the docs in our area that they are willing to listen to us and work with the people we serve to get them the best care that they deserve. That again, you're right. They're a person with a disability. The bottom line is they're a person.
Right.
I think what gets me is that they don't ask questions. They don't ask the caregiver that's with them, like, can they speak to me? How do they show me pain? How is this different today than their everyday? And it leads to the phone calls of, well, there's really not much we can do because they seem fine. Okay, well, me as the nurse, that's when I elaborate and say, okay, no, this is completely opposite. This is what they usually do. And so, no, they're not completely fine. So can we take another look?
Yeah. And that touches on the educational aspect, which is so important, and really just understanding that people communicate in different ways, but they're still communicating. And sometimes it might be through an adverse behavior, and that doesn't mean the person has a mental illness. It may mean that they have a really bad toothache or their stomach's very upset, and we need to look at that and figure out why. And that comes with training, I think, and understanding the differences in the ways people present with common medical conditions. I always say I don't really need to teach how to take care of the condition. It's how does it look differently? How does it present differently in people that don't use words to communicate? And knowing what questions to ask. Now, you touched on something about how it's different than how the person usually is. And I think that's an important concept. I always talk about knowing the person's baseline. And that can be different in every single person with a disability. They have different baselines, but people in support, people who are providing support, probably need to be able to, number one, know that person's baseline, and two, be able to communicate it to the clinicians and be able to clearly tell them what's different.
Yes.
Would you agree?
Yeah. And it's the approach. I think that they just need to have, it's not more of a backbone, but they need to be able to tell that doctor, no, I'm not comfortable with what you're saying. This is what I see. I think they just kind of, because they don't have the proper education, they feel like they aren't valuable enough to be heard, maybe. I'm not for sure, because once we as the nurses step up and try to, no, you're right. You're perfectly right. You had the right idea, and it's good that you pushed and you said that this is not right. But most of the time, it just seems like they know, they just don't push the way that they should.
Yeah. And we've had to train our staff that, to advocate for the people we serve. Don't just, a lot of times the docs will come in and they won't talk to the person, the patient. They talk to the caregiver, which at times you need to in order to get the right information communicated. But we really need to continue to step up and advocate and speak out for the people we serve. Because yes, and many of our local docs have recognized that, they can ask the patient, do you hurt? Some of them are going to say yes because they think that's what they're looking for.
Right.
And then, so you can't leave the person. You can't, you don't want to put any thoughts in their head. Do you have a headache? Well, they're going to say yes. So again, yes, you have to go more by observation. And we tell our staff, your observations are so critical to us in knowing what direction to take with the people we serve to get to the bottom of the issue and to find them the proper care.
Yeah.
Mm-hmm. Yeah.
So you've moved into the administrative world now. Have you seen? Are there different challenges that you have to deal with now, rather than just the medical or the healthcare part of it, that you can elaborate on?
Staffing issues.
I was anticipating you were going to say that first.
Yeah. Who isn't having staffing issues these days? Trying to attract good staff to do this job, because it's not just a job, it's a passion. Not everybody should be doing this, but when you get someone who is really good and really passionate about serving people with disabilities, they're golden. So the most frustrating thing, I think, is the funding issues. Is that our field is not recognized for whatever reasons. We're not making enough noise at the legislative level. We are trying. I think we are doing better. But the fact that our staff are not paid near what they are worth, and many people are not, but you've got people that can have a high school education that really have people's lives in their hands.
That's right.
And to not pay them a decent wage, and that's probably the most frustrating thing. Is trying to make ends meet when you're not a top priority.
Yeah. If you had the opportunity to be on a podcast and encourage people, especially direct support professionals and nurses, to work in this field, what would you say? What would you tell them about the field that you think would help them see it as a place to be? You talk about direct support professionals and you talk about nurses. How about that? Okay.
All right. Well, a little bit of nursing is obviously, spending 35 years in the field, it's a great field. For our direct care staff, just the relationships that they are able to build with the people served, the fun they can have. It is truly a fun profession. There are challenges. People do have, challenging behaviors. That you become attached to people. People become ill. They pass away. And it takes a piece of your heart with you. But it is a wonderful, wonderful profession, and you are making a difference. You are truly making a difference in someone's lives, and you can be the difference between them having just an okay existence to having a wonderful quality of life.
Yes.
So how about nursing, Deanna?
For nurses, I believe it's pretty much the same. We are not in the homes nearly as much as the DSPs, but you still see the light in their eyes, and it gives you light in your eyes. When I even walk into a house and they just, hi, how are you? The different ways they approach you, the different things the different attachments you get with them. For nursing, it is nice. Monday through Friday is how it's approached at first, but then you realize that no, it's 24/7, which is, it seems like a lot, but after you do it, it's just a phone call like, hey, your brother is doing this, or your uncle, it's not family, but it's just another phone call about someone that you care about. So, I mean, for nursing, it's more heartwarming than any other profession that I've done.
And I have to say, like, for our families, our families have become involved in, have met some of the people we served. I mean, they are just important to our families as they are to us. And my kids grew up, with mom, it's work on the phone, at any hour of the day.
Yeah.
And that's all they know. They're perfectly fine with it. That's just, how they grew up.
Yeah. And me being a mom of kids with disabilities and going to work, just the family and the work life just kind of combines, which is good for me. But other nurses, I think, feel the same.
Yeah. I think nursing as a whole, you never turn it off. Whether you work in an office, whether you work in a hospital, whether you work, in the IDD field, you're thinking about the people, whether it's your patients or your clients, you're thinking about the people you serve at all times, wondering what's going on with them. So it just becomes a part of your life.
Mm-hmm.
Yeah.
Definitely.
So great ads for people if you're considering working in this field, and I concur.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support.
So one of the things I do on the show is I call it 3 in 3, 3 things in 3 minutes, that they're basically just tips, words of wisdom, pieces of advice that you would like people to know either about this field or things that you think can improve the world for people with disabilities or health for people with disabilities. Just, you've got some things in your head that you're like, people need to know this, this, and this. So who wants to go first? Good move, Patty.
Well, I would say number one is treat them like they're people. Treat everyone the same. Just because they can't speak to you doesn't mean they don't understand you. It's just so important, and it's kind of hard when you see the way that they're approached because people don't understand or they just don't know how to talk to them or how to, even just say hi. That's my number one. I just talk to them because that's what they want. They don't want you to stare. They want you to say hi. So that's number one. Number two is, I guess, you don't realize what you got until you have it. You really don't understand what DD is until you're in it and you're working with it. But I don't know. I'm struggling with number three.
Let's get Patty.
No.
Okay. So I think first and foremost, people are people. They are not their disability. Just as from a nursing standpoint, our patients are not their diagnosis. The people we serve are not their disability. They are their abilities, and they are people.
Mm-hmm.
I think in this field, you need to recognize that it's okay to laugh, not at anyone by any means, but it's okay to laugh and have fun. And I'm struggling with a third thing too. Just,
Yes.
but it's just, I don't know. Again, it is a great career field
Mm-hmm.
and a necessary career field, kind of an unsung career field. So I would encourage anybody to consider it.
Well, out of the two of you, that's 4 things. So we'll let that count.
Let that slide.
All right. Yeah. But look, thank you so much for taking the time to talk with me today, to tell your stories. I think it's very valuable information for people to hear. I encourage people to look more into this field and learn more about it. If you're a nurse, if you're a direct support professional, if you're looking for a different line of work, and it's a very rewarding place to be. Thank you for being with me today, and thank you more importantly for the incredible work that you both do in the field.
Thank you for having us.